And we've got in the studio with us again Specialist Surgeon Naval Captain Paul Yegbe to take us through the paces when it comes to erectile dysfunction. And today we're zooming in on the treatments, the remedies. Do these concoctions and should I say aphrodisiacs you take, do they help or harm you? And what are the real things that really work? If you want to join us on WhatsApp, it's 0244-340437. Ultimate Health. We're looking at erectile dysfunction. Doc, you're most welcome.
Thank you very much.
Right. Now, 2 weeks ago, we had to take a break, of course, because of the World Stroke Day. But we learned about the complex mechanism that control male sexual arousal. Can we just quickly go over that and then the ways in which it can go wrong, and then we look at the remedies?
Yeah. Thank you very much. And I want to thank our listeners who continue to listen to us.
Right.
Hoping that our interaction with what we do here will change their lives. To start with, we want to define what an erectile dysfunction is.
Okay.
And the last time, we agreed that it is an inability to get an erection, maintain it, and use it for a sexual act.
Okay.
And this involves the brain, the hormones, the blood vessels, and a whole lot of chemicals in our body.
Right.
And anytime anything goes wrong with any of these factors, it affects our erection.
Okay.
So erection in the process is actually a very complex mechanism, meaning that the brain must have some interaction which goes down to the penis. Then the main action starts with a releasing of a nitric oxide.
Okay.
Nitric oxide is actually a natural chemical which is released in our body.
So the body already has nitric oxide.
Yes.
Right.
So it is directed to the smooth muscles of the penis. They become relaxed, dilated, and blood flows in. Now, in the process of the blood flowing in, it tightens on one membrane that we call tunica albuginea,
Right.
which has some type of holes with veins or outlet blood vessels in it. So in the process, these outlet blood vessels are tightened. So all the arterial blood that goes in make the penis very hard.
So in a sense, the blood is locked in.
Locked in.
Right.
Till maybe ejaculation or anything goes wrong.
Okay.
Then the membrane relaxes
and releases.
The return of the
then you lose
goes.
your erection.
You
so that's the normal process of male sexual arousal. Okay. Now, we said that your inability to attain and maintain
and use it.
Satisfactorily.
It's an erectile dysfunction.
Right. So if I have this once or twice,
yes.
Do I have an ED, an erectile dysfunction?
We will not want to say that. Once in a while, all of us will become stressed, we become tired, and there is a little bit of problem that we are not happy with. And the brain aspect of the mechanism might not work properly.
Okay.
So you might not be able to erect as you want.
Okay.
But this should not be a problem until it is becoming something that is frequent and lasts for maybe a month, 2 months or more.
Right.
Then you must see a doctor.
Okay.
You must see a doctor. It is very important you must see a doctor because, as we discussed the last time, these are signs that might be leading to a very more dangerous diseases.
Okay.
Like cardiovascular accidents, like
Stroke.
diabetics. Yes, stroke, diabetes, hypertension, or even
heart problems.
Yes,
right.
Heart problems, or even increase in your serum lipid.
Okay.
So it is important that you see the doctor, and the doctor tells you that yours is so and so, or it is just psychological.
Okay.
In which case, you might have to see a counselor
or a psychologist. Okay, right. 14 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. We're in the company of urologist, specialist surgeon, Naval Captain Paul Yegbe. He's gladly joined us again to wrap up what we discussed with regard to erectile dysfunction. Some call it impotence, right? But the inability of a man to achieve and maintain an erection sufficient enough for satisfactory sexual intercourse. And this should be quite frequent and persistent, right? More than 50% of the time you have this problem. And he underscores, you should see a doctor, because we learned 2 weeks ago that your erectile dysfunction could actually be an indicator pointing to other more serious health problems, diabetes, hypertension, heart conditions, and so many more. Right? That's what we've done so far.
Yes.
Okay. Right. Now, what would cause this process to go wrong? If we can just quickly just list a few of the possible causes.
Yeah, the possible causes could be a change in the intimal, that is the inner part of blood vessels.
Okay.
Especially the blood vessels in the penis,
Okay.
which we call the smooth muscles. They are very tiny and very weak, and a little bit of change can damage them.
Okay.
So if
It's ironic you say they are very tiny and very weak.
Yes.
When you look at or you consider what an erection is, right? And there are very tiny, fragile structures in there
Yes.
that could cause problems.
yes,
It's very ironic.
it's ironic
Yeah.
because, well, that is how nature has made
Right.
it. And the definition is that they are smooth and weak.
Okay.
That is why any problem that will involve blood vessels are seen there first. Now, what other things can cause this problem? As I said, increased blood pressure, a surge into them
Okay.
could be a problem. Smoking damages the intimal of the blood vessels
Okay.
and also destroy the nitric oxide, which is very essential for the relaxation of these muscles.
Okay.
Alcoholism, if we say alcoholism, I want to say somebody who is chronic alcoholic.
Right.
Not that taking alcohol once in a while,
Okay.
that will cause a damage.
So excessive use of alcohol.
Alcohol
Right.
is also a problem. And not to mention that sometimes low testosterone can also be a problem.
Okay.
Now, when we come to the treatment, we will be defining when
Okay.
you use testosterone replacement
Right.
to solve the problem
Okay.
or not.
Okay. 17 minutes past the hour of 2. We're dealing with the remedies, the treatments, and the, should I say, management and intervention options when it comes to erectile dysfunction. And we see and hear a lot of adverts and a lot of, should I say, information all over the place proclaiming certain substances or certain procedures and practices as remedies for erectile dysfunction. Do they want to dispel all that? What works and doesn't work? Right. And we're with a urologist, Dr. Paul Yegbe. Now, Doc, you just talked about the effect of certain hormones and so on and so forth. But when we come to look at this, we hear so many things, from direct penile injections, implants, oral medications. So maybe we should take these one by one. Having, let's assume that it has been diagnosed, you do have erectile dysfunction, right? We hear a lot about oral medications. The most popular or familiar of them now to many people is Viagra and its relative Cialis and a few others. What do these oral medications do?
Now, the oral medications, which we erroneously call aphrodisiacs,
Okay.
are to produce or to enhance the production of nitric oxide in the body.
Okay.
So the only thing they do is to make sure that there is enough nitric oxide to cause the relaxation of the smooth muscles in the penis.
Okay.
They do not cause excitement. So aphrodisiac by themselves are supposed to cause excitement.
Okay.
So if you go and take the oral medication and just sit down and be waiting that, oh, my penis will erect right now, it won't erect. There
Okay,
should
Doc,
be
let me
some form of excitement
Right.
from your partner or other things before.
Okay.
That
You're
can
saying that the nitric oxide is necessary. The body produces this.
Yes.
And when we take compounds like Viagra and the rest, they are simply enhancing the effect and the release of
nitric
nitric oxide.
Yes.
Now, for my listeners, did you classify these medications as aphrodisiacs, or did you distinguish them from aphrodisiacs? Because people take all sorts of things under the umbrella of aphrodisiacs. So when you're taking Viagra, are you taking an aphrodisiac? Yes, Doc.
Okay.
Mm-hmm.
When you take Viagra,
Mm-hmm.
you want to enhance erection.
Okay.
Aphrodisiac are supposed to increase your wish
Mm-hmm.
for sex.
Okay.
In doing so, they increase the excitement.
Mm-hmm.
But they alone, if you have erectile dysfunction and you take aphrodisiac as they are supposed to be,
Right.
you will not have any effect.
Okay. So just quickly before we move on, what would you say, all these adverts that seem to proclaim and promote
Yes.
various mixtures, substances, or whatever as, should I say, a remedy or a
for-
treatment? Sometimes they go as far as proclaiming treatment or cure of erectile dysfunction.
Yes. I wouldn't want to say that they are not effective.
Okay.
I wouldn't want to say that.
Mm-hmm.
They are compounds which have some effect on erection, because when people take it, they say, oh, they have some
Okay.
effect.
Right.
But what are the other components or
Ingredients.
ingredients in that?
Okay.
And most of the time, all the ingredients in that compound which is being used are not listed.
Mm-hmm.
And how are they compounded? How are they prepared?
Okay.
And what is the dosage that you need? That other components that are in it will not have effect on you later on.
Okay.
But what we are saying is that in any case, if you want to take these which are being proclaimed on the market, you must see your doctor. And your doctor will tell you that, oh, your erectile dysfunction is no problem. Any medication can treat it.
Okay.
Or your erectile dysfunction is associated with a coming diabetic mellitus,
Right.
or a coming serious heart problem, or a coming high level of cholesterol in your blood.
Right.
But if you do not do this and you do self-diagnosis and just go to the roadside and get the medication, I think that as a country,
You're putting yourself at risk.
as a country, we
Yeah.
should be looking at these things again.
Okay.
In other jurisdictions, the Food and Drug Board
Right.
insists that they know all the components in the herbal preparation.
Okay.
But in our country, as at now, I'm not of anything like
Right.
that. So it's about time we protect the citizenry
Okay.
from all these
Right. Okay.
things on the market.
So these aphrodisiac, these compounds that people or concoctions that people patronize, they don't come with the necessary safeguards and security as with the orthodox medications. That is what we're hearing from Dr. Paul Yegbe here as we discuss the remedies for erectile dysfunction. If you have any questions, concerns, you can WhatsApp us on 0244-340-437. Very shortly, I will activate the phone lines. This is Ultimate Health on Joy 99.7 FM. So, Doc, clearly, self-diagnosis, self-medication when it comes to erectile dysfunction is not a good thing.
I think it's wrong.
It's totally wrong.
Now, when we even look at the type of the orthodox medication that we have in the market,
Mm-hmm.
some are sildenafil, which is the main thing we call Viagra.
Right.
We have tadalafil, that is Cialis.
Mm-hmm.
We have vadanacil, Levitra.
Right.
All of these,
Mm-hmm.
they have a period with which they work.
Right.
Viagra is a bit shorter. Cialis, not too long.
Mm-hmm.
But tadalafil, it takes about 3 days to be in your blood.
Right.
So that if and when there is a contraindication to this medication, and you just go to the market and go and buy it without letting your doctor examine you properly, it can cause problem, especially when you are on nitrites. You can be azoxopat by dinitrite, azoxopat by mononitrite. These are agents.
Do these have common names that my listeners may know?
They are actually used when you have angina. Angina is you'll be walking, then you have a chest pain.
Right,
then
chest
you have
or
to
heart,
stop.
heart pain.
These
Right.
vessels, they dilate the vessels.
Okay.
So if you are taking substances which we already say they dilate blood vessels, and you add it to
You
them,
add the Viagra or any of the other
then
agents,
there will be a big problem.
there'll be a problem. And in the absence of proper examination by a qualified professional or specialist, you wouldn't be aware of this danger.
No, you will not know.
Right. So these substances, these medications are prescription only.
They should be.
Should I be able to walk into a pharmacy and ask for Viagra?
You should go with a prescription.
Right. And then I'll be, supplied only on prescription?
On prescription, and as the doctor required for you.
Okay.
Because if you even have maybe heart failure, heart failure is when the heart is not performing the function it's supposed to perform properly.
Okay.
It can also be a problem. Or you are somebody who is already hypotensive. That is your blood, you have a low blood pressure.
Right.
And you go and take this drug, it will reduce it further. And in the act, I'm sure you might not come out as you went in.
Right.
So I think that diagnosis by qualified doctors should become the mainstay of treatment of erectile dysfunction by everybody.
Okay, great. That's good to know, and everybody should know and take precautions when it comes to these medications. Even if you feel perhaps you have some connections or contacts and you are able to access these medications, Doc is saying you're putting yourself at serious, grievous risk when it comes to using them in the absence of proper medical examination and advice. Okay, if you have any questions, concerns, 0244-340-437, that's my WhatsApp line. Note, I called you last week and you gave my number to the nurse of the stroke unit. This must be Johnson. Right, we're following up on that. Okay, I will call you back. Right, you're still complaining about the attitude of the nurses, and I will follow up on that with Abeku. Abeku, that's Johnson, who called last week. We had a discussion with them, and they seemed aware of you and your issues. So I had hoped that it would be sorted out. But my apologies if it's still a problem. I will get back to you, Johnson, immediately after the show. I will call you. Right. So, Doc, that is with medication.
Yes.
Right. So once you take the medication, are you supposed to experience an immediate effect?
No, normally. No, it takes some time.
Right.
Especially people whose erectile dysfunction is due to uncontrolled diabetes.
Okay.
Especially those who have had prostate surgery or radiation surgery, to the radiation therapy to the pelvis. And most of the time, it's because of prostate cancer that these things are done.
Okay.
They find it difficult to have erection when the oral medications are used.
Okay. All right. Right. So that is the class or the category of oral medications. Yes. Right. And these would be prescribed by your doctor to control the ED. Okay. Right. Apart from oral medications, what is the next line of available treatment or management?
These are injections. But before we go there,
right,
I want to state that the treatment of the problem that led to the erectile dysfunction, if you go to the hospital, that will be the first thing the doctor will want to look at before thinking of solving the erectile dysfunction problem.
Right.
So if your sugar is not controlled, your blood pressure is high, the doctor will pay attention to these ones. And in doing so, it lessens the burden of the treatment of the erectile dysfunction. And this must be noted.
So the underlying problem, the root cause must be addressed.
Addressed first.
Right.
Before them.
Right, Doc. So that suggests that men who are buying all sorts of concoctions and taking them in the hope of curing or addressing their erectile dysfunction really are not curing anything.
The advice is that they should stop.
It's just treating a symptom.
They should stop it.
They should stop it. Yes. All right.
Now, so we have hitherto, we have had some medications which, when injected directly into the penis, injections.
Yeah.
into the penis,
Right.
they cause the relaxation of the smooth muscles that we have discussed.
So these would do the same thing the nitric oxide would do.
They will do the same thing the nitric oxide will do,
Okay.
but not involving the general system,
Okay.
only the penis.
So this is a local
The
administration.
local administration. which
Direct
has
penile
penile
injection.
injections.
Oof.
Now, we have all along used papaverine as an injection before. Phentolamine has been used before, but currently they are using prostaglandin. We call it Coverjet.
Right.
It is injected into the system. But we are seeing that the Coverjet, because it is already measured, the dosage is already measured. If you give it to the patient,
Right.
we will teach you how to do everything. You do it yourself anyway.
You inject yourself.
Yes.
Right. You'll
Yeah,
be given the needle
Yeah, you'll be taught
and
how to
taught how to inject directly
Just
into the
like-
penis.
Yeah. Just like diabetics have their insulin injection.
Right.
The needle is the same type.
Okay.
Now, when it is, these are the ones which has done. But currently, we are seeing that the prostaglandin is not treating most of the thing as the people want. Then there is another combination of the medications which are put together,
Okay.
combined together. It includes the prostaglandin, papaverine,
Right.
phentolamine, and it is called Trimix.
Right. Because it's three.
3 combined.
Right.
These are very good for some group of people.
Okay.
Then, in order to enhance it, another substance which also relaxes the smooth muscles in the penis called atropine is added.
Okay.
Of course, before this, the 4 combination which they call quad mix
Right.
is given to you, the doctor must ensure that you do not have glaucoma. Of course, there are 2 types, closed and open. But in our setup, you are not told whether it is a closed one
Right.
or it's an open
So
one.
essentially, your doctor is making sure that there's no condition or no contraindication
contraindication to what is giving you.
that would make you unsuitable for the penile,
For the penile
injections
injection.
and the medications that you are
medication,
injecting directly into
Directly.
the penis to achieve or to enhance
Erection.
erection.
Yes.
Right.
Now, if you have the glaucoma and this is given in combination with atropine, you might become blind.
Okay.
So it's a serious issue.
Right.
Now, the good thing about these combinations is that whether you like it or not, you have erection.
You will get an erection, whether you like it or not. Once you've injected yourself,
have
you are
it.
on.
Yes, you
You're
have
in
it.
business.
And
okay.
the other good thing about it for this trimix thing or quad mix is that it does not have anything to do with the general body system.
Okay.
So the contraindications are very, very, very minimal.
Right. So it should be suitable for a lot of people.
A lot of people. And the moment you give it 3, 4, 5 minutes, it's broken down.
Right. The body will get rid of it.
Get off it, like it is metabolized easily into something that is not any active.
Then can be excreted by the body.
Excreted
Okay.
by the body.
Doc, a few questions here. So I'm being taught, trained to inject myself.
Yes.
Right?
Yes.
To address my erectile challenges.
Yes.
Right? And you're saying, well, based on the mix of medications, the general expectation is that as soon or not long after I have injected myself, I will achieve an erection.
Yes.
Okay. Now, these fine vessels and this very delicate organ, the penis, what kind of needle are we using? I'm getting worried, but I'm told it's a very fine needle.
Yeah, it is the one used by the diabetes. It's a
Right.
very tiny, is it grade 3?
Right.
It's very small. You would, even when you hold it, you might not see it properly.
Okay.
Now, you are not injecting directly into the vessels.
Okay.
You are injecting into the corpora cavernosa. It's the tissue
The tissue.
that causes the
So are
hardening
you
of the
are you
penis.
injecting the side,
On the side.
on the side
on
of
the
the
side of the penis
Right.
and in the base?
And
now,
the
when
base.
you even look at the penis,
Okay.
there are 3 things. The down part is called urethra, which where we urinate.
right?
But the top is where the corpora cavernosa, the erectile tissues are.
Okay.
So you can inject on this side, on that side, at the base, as you wish. And, everything.
Wow, we're
So
learning
that is about
right.
the injection.
Okay.
Trimix, quad mix, and you can even have bimix,
Okay.
depending on the severity
And
of
these
the problem.
mixtures or these decisions about what exactly is being injected are taken by your doctor.
Yes.
Nobody else.
No.
You shouldn't be going to a pharmacy and they say we have a mix, or somebody meets you on a bus and say I have this thing, you inject it and this and this and that.
Yeah. Another thing that must be looked at is that the dosage is decided by examination of you.
Okay.
And also, there is something we call Doppler scan.
Mm-hmm.
The doctor will use it and make sure that how damaged are your blood vessels.
Okay.
Because you yourself, you will hear the sound as he's doing it.
Right.
And he will
The
compare
Doppler
the Doppler
scan.
scan
Right.
for the vessels.
So it's a form of medical imaging.
Yeah, it's an
So he can
imaging.
look at your vessels.
You can look at the function, how strong your blood vessels are.
Okay.
As the doctor is doing it.
Mhm.
And this this allows the doctor to know what amount to be given to
Okay.
you. If he's giving too much, you have priapism.
Okay.
The erection will last more
An erection that doesn't go away.
more than 4-6 hours you are there, and sometimes it can be very painful.
Oh boy. All right, 35 minutes past the hour of 2. I'll give Doc a breather and take, on that note, I'll give him a breather and take a couple of messages. This one says, please ask Doc how he would classify Comet. Is there medication or anything called
Yeah,
Comet?
Comet is tadalafil.
Right,
It's
okay.
one of the strong
In the class of Viagra and Cialis.
Viagra, Cialis, tadalafil.
Right, okay. Right. Linda Inosu, let me see. Hello, Note. Thanks very much for this education. I think there should be a general awareness on the effect of these drugs because our young ones use some of these drugs without knowing the harm it will cause. This is from Linda Inosu. Great point there, Linda. Dede in Maryland says, I understand the Kegel exercise can help with the treatment of erectile dysfunction. Can the exercises without medication cure ED? And she puts cure in quotes there. So we'll note that one when we get to. Right. Okay. Thanks very much, Dede, for sharing that. What else do I have? Oh, this one says, can't see where it's sending me a picture rather. Okay. Mm-hmm. Right. Getting some help here.
Okay, can I comment on the
Yes.
Osu?
Yeah, the Kegel and the
Osu.
Osu one about
Yeah,
education.
So I'm glad to hear somebody saying that our young ones are taking this drug, which they don't know about.
Right.
The issue is that when they take it,
Okay.
what they come to the hospital is priapism.
Right.
Priapism is okay, priapism, but they do not come early. Some come.
You have an erection and it's
It's
not
not
going away. That
Some
is
come-
priapism.
Yes.
Right. And it's
Some-
painful and it's a
some-
medical emergency.
It's painful for the first 24 hours.
Hmm.
And
Gosh,
these
you're
people
even
come-
talking about a day, Doc. 24 hours with an erection that's not going away.
Yes, but they keep it and come after 10 days.
Ah,
Now, when they come after this long period,
Hmm.
we will try and remove the clotted blood from the penis.
okay.
But we cannot remove all. When the blood comes, when it is you stay very long, the blood we remove is black and thick. But the spaces that are filled by the blood vessels, at the time, these thick bloods will block it. Your
So it's,
penis
it's like a
become-
sponge.
Yes. So your
And
your-
because of the prolonged erection, the blood clots in the
Clots in
sponge, and then you now have to evacuate the blood.
Yes, but we cannot remove all, not under any circumstances.
Mm.
So what happened is that it pains our heart
Mm.
that a young man of 24 years, 25 years, or even 30 years will not have erection again, no matter what.
Wow.
So these are the things, and I'm very grateful
To Linda,
the
and
quest-
also, yeah,
to Linda
pointing
that he
this
has
out.
brought this
Right.
up. And I think that if we can find a way of educating the young men about these things, it will go a long way to protect them.
Okay, great. In fact, all the men, Doc. Hi, my name is Kwesi Buck from Bokuno Junction. I want to know the causes of premature ejaculation and how to deal with it. Okay. We're focusing on erectile dysfunction, but I think Doc will squeeze in a word when it comes to that. Nothing here. It just says hi. Maybe you're still typing. Let me quickly retrieve. Good afternoon. When having sex and using a condom, and after which the condom gets loose whilst you haven't removed the condom, and then later you see some line on your manhood which has been there for long. What is the cause? This is from somebody in McCarthy Hill. I'm not sure what you're talking about, right? So he's saying, well, you've used a condom and it becomes, well, the penis becomes a bit flaccid and then the condom is loose. He says he sees a line.
Is it a circular line? If it's a circular line, maybe it's the contact at the end where the small ring is.
There's a Peter who sends us messages from McCarthy. If it's you, yes, Peter, please send that again and let's see if we can get it. I want to know whether that diet can help improve or manage erectile dysfunction. Ni from La says, how do you treat premature ejaculation? Everybody seems to want to go there. We're focusing on erectile dysfunction. We'll come back, right? Again, the question on diet and erectile dysfunction. People are looking at the lifestyle factors that we'll talk about in a bit.
We're talking about them.
Right. Please, is there any distinction or difference between erectile dysfunction and premature ejaculation? We covered this the last time. But if you can go over it, Doc, please, for us.
So, premature ejaculation, by definition, is when preparing to have sex or you are erect, the moment you enter, or even sometimes you have not entered, then you ejaculate. And that thing goes down.
Okay, so you actually get the erection.
Within a minute.
Right. And
within
then
a minute. You get the erection, all right.
You climax.
You climax within a minute.
Before time.
Yeah.
Okay.
But erection is the hardening of the penis.
Right. So we're dealing with the mechanism of the erection and how to achieve that. Right. Somebody's sending me a picture which he says is he went for a lab check and this is my result. He's yet to see the doctor. Okay, your picture is still loading. We can't discuss that on air. Good afternoon, Joy FM. I want to find out whether taking Keddy's food supplement like Revive can damage your health. This is from Francis in Akuse. He's talking about his food supplement. I don't know whether you're aware of
the food. I don't know the contents, what it contains.
Right.
We can only comment on it if we know what is inside.
Okay. All right. Okay. 42 minutes past the hour of 2. Let me announce the phone line 0302-216-541. 0302-216-541. You can get in on the discussion. We're talking about remedies for erectile dysfunction with specialist surgeon, Naval Captain Paul Yegbe. I think the person was sending some PSA result or something.
No problem.
Right. I'll get back to you and see if I can refer that to Doc.
Surgical.
Right. Yes. So surgical, no, Doc. But before we go to surgical, my phone line is active, by the way, listeners. 0302-216-541. Before we get to surgical, are there any problems with this penile injection? I know if you don't do the right thing, you can get an abscess or certain problems. Will there be any bleeding when you inject?
For the penile injection, if you will be taught how to do it yourself, but once in a while, there will be a small amount of bleeding, which if you put pressure on, it will go.
Okay.
And another aspect is that if you are not careful, the needle might break in the penis. So there is auto pens which are used to give it. So you don't just put it yourself.
Okay, great.
Then another is if you inject on the same side, every day you are doing it on that side, that particular side, it becomes fibroids. Okay. And you might end up letting your
So I guess you'll be educated on all these dangers.
Yes,
okay,
yes.
I have Atu on my line, Doc. Good afternoon, Atu. Thanks for waiting.
Good afternoon.
Yes, speak up a bit, please, Atu.
Good afternoon.
Yes, afternoon.
Yes, I'm a diabetic. And then I used to have erection, but currently I'm not having erection again. And then after when I used to have erection, my sperm used to come. But now when after having sex, it doesn't come at all. I don't know whether it's because of diabetes or because of erection. I don't know whether I have. I don't know really.
Okay.
Even though I have satisfaction after having sex, it's just like I don't erect, and then my sperm doesn't come at all.
Okay, but Atu, before I pass this to Doc, are you seeing a doctor? Are you being managed for your diabetes by a doctor?
It's got a long time.
Pardon?
It's got a long time.
So you haven't been seeing your doctor?
Yes.
Okay. All right. Let me quickly just take another call and then we'll come back. He's diabetic and he's having some problems with the erection and then ejaculation as well. Niyama is on my line. Good afternoon, Niyama.
Yeah, good afternoon.
Right. Where are you calling from?
From Osu.
Osu. Right. Share with us quickly.
I want to find out if venous enlargement pills or cream can cause erectile dysfunction in the future.
Okay. Penis enlargement pills, can they cause ED in the future? This is from Niyama calling us from Musu. And let me just read this. The question is, after sex, you see a long line on your manhood while the condom is loose. And on you, whilst you remove, you see the line. This is the gentleman who says he sees a line. I'm not too clear what it is. All right. Perhaps, Peter, does it go away? Let us know. But we can follow up. So the diabetic who has challenges.
Yeah.
He says he's had some difficulties, not in contact with his doctor, but he's also not seeing that he ejaculates.
Yes. Diabetes has become so common that we do not see it as a very bad and dangerous disease anymore.
Okay.
So people have diabetes.
We've become comfortable with it.
You tell them to even control it, they are reluctant to do it. I want to say that it is a very, very, very bad disease. It affects every part of your body. It affects the muscles everywhere, what we call diabetic neuropathy.
Okay.
Now, what happens is that during ejaculation, when the semen come out into the urethra,
Right.
it goes back
Okay.
to the bladder neck, hit it, gather enough
Momentum or pressure, right?
with the contraction of the muscles around the urethra, then it comes out.
Okay.
But in the diabetes, these contractions of the muscles are deficient.
Okay.
So when it hits the bladder neck, instead of going forward, they go further into the urine
Okay.
and
Right.
remain there.
But-
so you think that you have ejaculated, but
Okay.
nothing will come out.
Right. Okay. My numbers again 0302-216-541. 0302-216-541. John is on my line also from Osu. Good afternoon, John.
Good afternoon, Rodney. How are you?
I'm fine, thanks. You're most welcome. Share with us quickly.
Yeah, quickly. You have like a pre-ejaculation in the first,
Right.
and then after that it takes so long to erect.
Okay. So that's your question. Why does it take so long after
So
you've
what's
ejaculated?
What's the cost of it?
Okie dokie. Right. This one is from Kwame in Germany. Thanks, Kwame. He says, can penis pumps and vacuum pumps remedy ED as well? They're also on our list for consideration in the different methods. Does prostate cause low sperm count? I don't know whether you're referring to prostate cancer. It's a question here from the person who sent the test results earlier. Good afternoon. My name is Eric from Achimota. Is there a number to call if I want to book an appointment with the doctor? Eric, we'll sort that out later. So I'll note your number. Right. This question of the refractory phase after you've ejaculated, it's difficult to get an erection again.
I would call it relative.
Okay.
Because you have to have energy to have erection.
Okay.
So if you are tired before going for the first one, the second will delay. But as long as it will come, I think it should not be a problem.
Okay.
It should not be a problem.
So you should be patient.
Yes, there is no pathological thing that should be associated with
Okay, right. Okay, so if you've had your fair share the first time, be patient. And impatience actually can complicate the matter. The fact that you are in a hurry can also complicate the matter. Right, 48 minutes past the hour of 2. Yeah. Somebody was asking about prostate.
Yes.
And its relation to low sperm count.
It could be when we stretch it. If you say prostate, is it the enlargement
Right.
or the prostate cancer?
Okay.
But what was shown, the
PSA.
PSA value that was shown
Right.
is normal.
Right.
So I don't think it should have anything to do with
Okay.
with sperm count.
Okay, great. A lot of people are asking, Doc, for you to delve into solutions or remedies for premature ejaculation. Haven't explained it. I've got a couple of people saying you haven't answered PE. Which is not physical education, but premature ejaculation.
It should be another topic.
We should do a whole program on that. But there are solutions for it.
There are solutions.
Okay, right. Now, we're talking about surgical interventions for erectile dysfunction.
Yes. Yeah, the surgical interventions, they're there. Anything is there, solution is there.
Right.
Now, for the surgical aspects, we have what we call the malleables, and another one is when a pump is inserted and tubes are passed through the two erectile tissues.
So surgically
you insert it,
pumps
there,
right,
with rods in the penis.
Okay.
If you want to have sex, you press on it on your side.
You press the pump.
You press
on your side.
The pump.
Okay.
Then the penis comes.
So almost like something hydraulic.
It's a hydraulic pressure more of.
Wow.
Then another one is when malleable rods are used. That is, the rods are put into two rods are put into the penis.
Okay.
If you want to have sex, then you unfold it, you have the sex. When you finish, you unfold it, you fold it back and wear your underwear, then you take off.
Okay.
But these, most of the time,
these are surgically implanted now.
They are surgically implanted.
Okay.
People wish it, but thereafter, they don't want it again and have to remove them.
Okay. Right. I have another caller on the line. Hello.
Hello, me?
Yes, good afternoon.
Yeah, John again from Osu.
John from Osu, yeah.
Quick, I just want to know if that the pre-ejaculation, is it from diet, from alcohol, I just want to know.
Okay. So your problem is with pre-ejaculation, not with attaining and maintaining an erection.
Or maybe because of your job or the type of job that you're doing.
Right. Okay. So he's asking whether stress and other things.
Yeah. Stress is part of it. Earlier on, masturbation is out of. It's a big topic.
Okay.
If I say certain things now, I will set people's mind confused.
Right.
So
you'd want us to.
Yeah, we start from the basis, then we climb.
So our discussion on PE is premature. Even though we talked about it. So listeners, Doc is promising to make time for us to look at it.
Mr. Bia to
I should bring you and bring it back on another Sunday. Yes. But Doc, so surgical implants, you're putting, should I say, in a sense, almost mechanical devices down there.
Yes.
And this is also, it sounds to me a drastic remedy. Or
yes, it's a drastic.
Is it that all others have failed before you get to this point?
All others have failed. And even before we come to the surgical,
right,
we might even talk of the pump, the suction pump,
right, the penile pumps, right.
Yeah, the penile pump, where the pump vacuum is placed around the penis.
Right.
You create a pressure in,
right,
and a vacuum is created, and the blood is sucked into the penis.
Right.
Then after that, you put a ring.
A ring at the base
of the penis.
Right.
Then you have your...
to prevent the blood from flowing out.
Back. Then when you have the sex finished, then you remove it. But invariably, there are two problems. One, sometimes people forget after the sex to remove it. And
the ring?
Yeah, to remove the ring.
Okay.
It's stuck there. And after a long period, because of lack of venous return from the blood, we have to go and cut it, and sometimes it can be problematic. Okay, so the vacuum, sorry, Doc, but the vacuum or the suction pump creates the pressure, right? And drain blood from the body into the penis. Okay, that forces the blood into the penis, which should have happened naturally. No. And then you lock it with the ring at the base. Okay. Then, secondly, what people worry about, that they should see semen coming after ejaculation. It will not happen because the lock is at the base. Oh, so you will actually have, should I say, intercourse, all right? Yes, but no semen coming. You've locked everything. You locked everything up. And the benefit of sex on the side of the man is a bit reduced. Okay. And frequent pumping also injured the fibers of the corpora cavernosa. Okay. And there are problems which might happen later on. Okay. Yes. Right. So it comes with its positives and negatives. All right. Yes. Hello, I'm Bernard. My problem is anytime I have sex, I ejaculate in just 1 minute. And after, I will find it difficult to erect again if I want to go for the second round. What's the cause? discussion of premature ejaculation
Right.
is premature.
It's premature. We'll get to those, right? But
Yes.
naturally, Doc, I think maybe you need to bring this out. We know that after an ejaculation, there's a short period where naturally there's a pause.
Yeah, there's a position.
You can't have a constant.
No, you can't just continue.
Right. Okay. So some people may actually be in a hurry
Yes.
and worrying unnecessarily.
And when you worry, the more loser it becomes.
Okay. All right. I hope we've answered that question. So outside these, we've done the surgical implants, we've done the penile pump, we've done the direct injections into the penis,
Yes.
and then we've talked about oral medication. Right.
Then there is another one coming up. About 30 or so years ago, these waves, which are used to break stones,
Right.
like extracorporeal shock waves,
Right.
have been used for about 30 years. Then about 10 years ago, some people think that if the problem of erectile dysfunction is due to a vascular block, like what happened when there is atherosclerosis, or there is a
So
high
there's a block in your arteries,
in
or
the artery, so the blood cannot flow
okay.
into it.
Right.
These equipments, that is the extracorporeal shock wave,
Mm-hmm.
can be used to break these ones. In a course of 3,
So
4,
breaking whatever is causing the
causing
block
the
or the occlusion, the
obstruction.
obstruction. Right.
in 3-4 weeks,
Okay.
erection resumes.
Okay. And again, all of this depends on proper assessment.
A proper assessment to know what is the cause. Of course, if it is diabetes,
Okay.
you use the extracorporeal waves, it will not break anything.
All right.
If it is due to hypertension, which has destroyed the intima of the blood vessels, nothing will happen.
Okay.
So these all need to be assessed properly before
Okay.
the treatment is given.
Right. 4 minutes to wrap up time or to closing time on Ultimate Health on Joy 99.7 FM. We've been talking with Dr. Paul Yegbe, specialist urologist at the 37 Military Hospital. Actually, he's Captain Paul Yegbe. Right, Surgeon Captain Paul Yegbe. I need to throw salute properly, right? But he's been taking his time, and he comes back to educate us on these things. But these are serious problems, and especially because you say it could also indicate that you have other medical issues that must be taken care of. All right. Now, the gentleman, I believe it's a gentleman who sent us the picture of his tests. I just want to say this and underscore this. You are now asking Doc to determine from the image whether your prostate is enlarged or not. We do not do these things over the radio waves. All right? So I'll see how to patch you through to Doc or any other facility before people say I'm promoting Doc alone. Right? Right. Okay. Right. So please, that's why we haven't answered that. We can't look at your test scores and you send them in by WhatsApp and then Doc gives a comment. It's not professional. It's not ethical. So that's why. And I wanted to share that for everybody else to hear. Or Doc, am I doing the wrong thing?
Right.
Yeah.
We have to keep your medical issue confidential.
Right.
And any doctor who does that,
Okay.
go against it, can be punished.
Okay.
Severely.
Right. Last one here. Hi, I'm Listowell, level 400 student at GIJ. My group is looking at erectile dysfunction. Can I get the contact of the doctor and, if possible, have an interview with him? All right, Listowell, we'll see what we can do in that regard. If you're learning, we will help facilitate your learning at GIJ. I wonder why you guys chose that topic, but interesting.
So the
Yeah.
psychological
Right.
stress.
Yeah. We have a minute or so. We did talk about stress and lifestyle, but if you can quickly on the Kegel exercise, the muscle exercises.
Yes. So before that, let's say that there are some other problems that can lead to erectile dysfunction. These are the psychological
Right.
one. Stress,
Relationship issues.
depression, and other things can also be part of this. So if you have them, the best thing is that you and your partner
Right.
must go and get proper counseling.
Counseling.
Marriage is supposed to be enjoyed. But if your relationship with each other is not working, please get advice.
All right.
And the thing is that marriage, some of us think that it's a very conscious effort. So make the conscious effort and be in it.
Right.
And not let it destroy your
Okay.
marriage.
Essentially, Doc is saying anything that works is work. So work at it. And if there are problems, seek the solutions. And that could be the perhaps the root cause of your erectile dysfunction.
Then after this, let's look at the other alternative.
We only have 1 minute.
Treatment.
Right.
Acupuncture
Uh-huh.
is one.
Okay.
But acupuncture is used to treat stress. So if you have a very good person who is good at acupuncture, you can see. Then we have the Kegel exercise.
Right.
Kegel exercise is a type of muscle contraction in the perineum
Okay.
to strengthen the muscles there.
Okay.
And sometimes people think that if you have erectile dysfunction, about 40% of the cause is due to the weakness of
On the muscles.
the muscles. And these are described nicely, in a way that anybody can understand in some networks.
Okay.
So if you get to them, just Google Kegel's exercise.
Right.
They will tell you what to do. It's a long exercise to describe.
Okay.
We might not have time
Okay.
to do that now.
Right. There's always a squeeze when I have Doc here. But Doc, many thanks, and our gratitude is something that we can't even put we can't measure. But definitely our people and our listeners want to know more about premature ejaculation, and we also have another date we've set aside for prostate issues.
cancer,
Many thanks again. Always a pleasure. Next up is Bile. He comes with Sunday Rhythms. We've learnt a lot, and I hope we've been able to fix your problems. But if not, we'll do a continuation next week. But for now, take some soothing music from Bile. Sunday Rhythms. I'm out.
We bring you joy on the airwaves. We bring you joy, lighting up your night, cool your day. So when you feel low, all you gotta do is turn on the power on your radio. Tune in, get joy in stereo.
It's Belay on Joy 99.